Goeienaand, good evening fellow South Africans and citizens of the world. Now, to start off this video, I want to show you a chart. And what I want you to concentrate on are the black symbols representing people who got a local transmission. That's what I've been referring to in my earlier videos. That is central to a cluster appearing, because it's not someone who's come overseas, landed in South Africa with the virus. This is a local transmission between two people. And where it's really dangerous is where someone with the coronavirus is walking around and infecting other people without even realizing he or she is doing so. So let's have a look at those local infections in three areas now: KwaZulu-Natal, Western Cape, and Gauteng. Okay, now you'd think at this time the South African government would want as much information to get out to the community as possible. But no, because their public hospital system is a complete disaster and was underwater before the first coronavirus case appeared, well, it's now going to censor people from talking about what's happening in South Africa over the coronavirus. Well, I'm just making a statement here and now. I don't live in South Africa. I will present the news that I get, which is reliable news, and I will tell the world about what is going on in South Africa. I'm not going to be beholden to some stupid little government body that decides what can and cannot be said. That's called censorship. And that's what's happening right now to every media in South Africa, is they are being censored by the ANC government. So for your reliable source on what's actually happening with the coronavirus in South Africa, come to Loving Life. I will tell you the facts. I won't go according to the cover-up that the government are trying to put in play, obviously because of the complete failure of the public health system in South Africa. Let me just add a bit of meat to the bone. Government has effectively gagged epidemiologists, virologists, infectious disease specialists, and other experts on the coronavirus with an instruction that all requests for comment about the state of the pandemic, the virus itself and its spread, should be directed to the National Institute for Communicable Diseases, or NICD. Several senior and experienced scientists said that they were requested not to speak to the media and to direct all communication to the NICD. The Ministry of Health confirmed this, saying that communication around the coronavirus needed to be tightened and that experts needed to be left alone to do their work. This means that for the most part, with a few exceptions, only government's version of the spread of the virus is reaching the public. This is amid a sharp rise reported cases over the last 48 hours. As of Wednesday morning, the Department of Health confirmed 116 cases. That figure stood at 62 yesterday morning and 85 last night. Now, it's self-evident what's happening. The virus is starting to spread into the community. And as I said, these clusters, that's what you're going to watch. What they should be doing is providing information as to where that person-to-person transmission happened in a particular city, the region, the suburb, so people can be on the alert. But they're not doing that. They did that here in Australia. So when the first person-to-person infections happened, they said, stay out of this particular area because this is where it happened. So what they're doing is they're setting a recipe for disaster in South Africa. And of course, censoring everything is just going to compound that impact. Very few sources have broken ranks to talk to the media on the record. In many instances, the same sources are being interviewed across various media platforms. Senior academics and researchers have expressed frustration that not enough information is getting out to the public as a result of this. Several senior and experienced scientists confirmed that they were requested not to speak to the media and to direct all communications to the NICD, also known as censorship. Ministry of Health spokesperson Lwazi Manzi said that the government had decided that all communications should be centralized to just a few voices: ministers, deputy ministers, MECs, and sometimes even Cyril Hippo-Eyes Ramaphosa. This was to ensure there was a simple line of communication regarding COVID-19, or the coronavirus, which would also assist government in combating fake news. Don't they love to bring that up? Guess who's going to be spreading fake news? Yeah, you heard it from me. The government, the ANC government. They are the biggest fakers in South Africa. My God, talk about hypocrisy. Anyway, Manzi went on to say, you can't have people from Lancet, Ampath, Wits all speaking to the media. There is a need to differentiate between authority and noise. She said that technicians and experts had asked for communication to be directed away from them because they were overwhelmed with requests for comment. Manzi said, these people must work. We can't have them speaking to the media. You guys call people at 4 a.m. this morning. She said experts needed to be relieved of the burden of dealing with the press to focus on their duties as professionals. My gosh, talk about a cover-up. Well, as I've said, on Loving Life, I'm going to spill the beans because guess what? Guess what? I am not in South Africa. I am in Australia, and the ANC have no hold over me. Nothing. Tits. Absolutely nada. Nothing. Forget it. Huh. Good luck, ANC. A public health specialist interviewed by a paper pointed out that while it was important for government to centralize information about infection rates, this should not be a blanket rule. She said that it made sense for government to want to avoid a number of different infection rate counts doing the rounds, and for the NICD to be the only authoritative voice on this, but this should not amount to an instruction not to talk to journalists at all, she said. Yet some experts interviewed expressed frustration over the situation and said there was a need for communication on COVID-19 from more non-governmental sources. Well, I'm going to put my email address down below this video, and anyone who's an expert in this area wants to send me an email, they can be anonymous and we will have a live stream or we'll just have an interview and you can give us information, okay? I don't care. If you're an expert and you've got the correct information that the government is covering up, let's let the public know. That's the bottom line. Obviously, I'll need to know your credentials before we do this, but once we've covered that, your anonymity will be guaranteed and we will spill the beans. Let's continue. Two other experts, one a professor and the other a medical doctor, both highly specialized in the fields of virology and immunology, also stated that they were not allowed to speak to the media and that they had been told to send any queries to the NICD. However, both said that they felt it was important to give information to the press, as the NICD was overwhelmed by requests for information, and so not enough information about COVID-19 was getting out. One of the experts said, I can't even get through to the NICD right now, pointing out that he was actively working on the COVID-19 issue. Get that? You can't even get through on their phone line. They've probably got one phone line. You've probably got two people working in an office, fudging figures. And this is now the authoritative source. Wonderful. Absolutely wonderful. Only in South Africa. My God, you can't make this shit up, can you? Anyway, let's continue. Another academic, a highly specialized infectious disease researcher, experienced in the field of infection rates modeling, said that they could not speak about any matter relating to COVID-19. These experts are not only valuable for the in-depth knowledge of infectious diseases, but are intimately acquainted with the COVID-19 pandemic and the state's response to it. Okay, now what you've effectively got, this is the joke. This is the joke. They've shut up the experts, and now you're going to have these dumbasses who are members of parliament and ministers of health, ministers whatever, who are now going to be the authoritative voice on the coronavirus at this critical time. What a joke! What a friggin' joke! You know, I could I could say something that could get me thrown off YouTube right now, but I'm not gonna. Okay, I'm just not gonna, guys. I'm just not gonna. But you know where I'm going with this. The president of the Federation of Infectious Disease Society of Southern Africa, FIDSSA, Professor Nilesh Govender, said on Monday he could not speak as he also worked for the NICD. According to its website, the Federation of Infectious Diseases Society of South Africa was formed from an amalgamation of existing societies representing infectious diseases. In 2020, Federation member societies included the Infectious Disease Society of Southern Africa, or IDSSA, Infectious Control Society of South Africa, or ICSSA, South African Society for Clinical Microbiology, SASCM, and South African Society of Pediatric Infectious Diseases, or SASPID. ICSSA, for example, has a society in each province. And the media aren't able to contact any of these people now. So look, I'm just appealing to someone who's an expert, and if one of my subscribers is an expert, or if you know an expert, please just get them to email me. I will happily spread the truth once your credentials have been verified. And we will do that on this channel, which has a huge audience in South Africa. About 75% of my subscribers are based in South Africa. So it's a very, very large audience. One respondent said queries would have to be directed through the CEO of the private hospital for whom they work. Another senior risk manager at a large medical aid scheme also could not speak about COVID-19 matters on the record. Government's Central Communication Agency, the Government Communication and Information System, did not respond to questions sent on Wednesday morning. Of course they aren't. They're just covering up. Look, the truth of the matter, guys, is this is nothing about fake news. This is about a cover-up when the shit hits a fan, because that public health system is a complete and utter disgrace. And walking into the doors of a public hospital right now, sitting in that waiting room for 6 to 8 hours while people are coughing and spluttering and whatever, if you didn't have the COVID virus before you walked in, believe me, you will have it before you walk out. That's the reality, because the public hospital system is a disgrace. It's a disaster. And there's no way in the world they can cope with this, and they know it. And that's what this is all about. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe. Bye for now.